Folks, this is Cynthia from Salesforce. I'll use the acronym that was used several times yesterday from the HLS team, Healthcare and Life Sciences Solutions team. So Cynthia has been working on competitive intelligence, opportunity analysis, market analysis, and so on for market sizing as well for various opportunities in healthcare. Prior to Salesforce, she's worked at Accenture and several other companies doing similar market research in other areas. Yeah. So Cynthia is going to talk about a topic that's very near and dear to me, and we have discussed this at length together, which is the recent ruling earlier this year from the HHS, Health and Human Services Division of the federal government, to unlock patient health records, essentially provide patients access to their own data and authorize them to have other physicians have access to their data. And all the innovation and opportunities that opens up. So sorry for stealing some of your thunder, but yeah, please take it from here.
Well, I'm always happy to see excitement about the topic. So I want to start with thanking you, Atul and DigExchange, for having me today. As Atul said, I am a researcher with a public policy background, specifically tech policy, and I specialize in identifying market trends and sizing, opportunity analysis, and studying the impacts of policy developments on tech. I was previously a tech research specialist at Accenture Research, and before that, I worked for a tech policy trade association and as policy analyst for the Association for Computing Machinery, ACM. And currently my focus is on the healthcare and life science industries. And today we will be talking about interoperability in healthcare. So before getting started, I will note the disclaimer that the opinions and views expressed in this presentation are solely my own and do not express the views or opinions of my employer. For today's presentation, I'll be walking you through these new developments in healthcare interoperability, explaining the key components that will enable greater interoperability, and walk you through why this matters now in the new normal. And so once we have that context, I'll present what I like to call a market opportunities analysis. And this is essentially a scenario building exercise. We will look at assumptions and predictions on the kind of health tech and solutions that will gain momentum based on these changes. So with that, let's start with, what is interoperability? So interoperability in healthcare is the ability of a system to exchange electronic health information and use electronic health information from other systems without special effort on the part of the user. So please keep this definition in mind as we go through. Interoperability and update. So in March 2020, in the US, rules were finalized to provide patients more control of their health data. The rules require both public and private entities to share health information between patients and other parties while keeping that information private and secure. So the rules implement interoperability and patient access, and they share a common goal of allowing patients to go online and download their health information for themselves and also to share with others. This includes patient transmission of data to a third party. So the aim is to increase innovation and competition by fostering an ecosystem of new applications that provide patients with more choices in their healthcare. The analysis that we will look at today is based on a future where, one, there is widespread interoperability, and two, patients are able to securely and easily obtain and use their electronic health information from their providers using the smartphone app of their choice. So one key provision is the standardized criteria for APIs. So the rules identify Health Level 7, also now called HL7, Fast Healthcare Interoperability Resources, FHIR, as the foundational standard to support data exchange via secure application programming interfaces, APIs. So entities will be adopting the standards for FHIR-based APIs finalized by the rule. And these requirements support the privacy and security of patient information. And they also are meant to support patient access and control of this information. So you're probably wondering, what is FHIR? And let's start with what is an API. So APIs are sets of requirements that govern how applications communicate and interact with one another. An API is an interface that provides developers with programmatic access to a proprietary software application. So these APIs are interconnected on any healthcare system, and they connect doctors, patients, medical devices by normalizing incoming requests and data as appropriate FHIR resources. But what is FHIR, you ask? Well, health records are becoming increasingly digitized, as we just heard. And as patients move around the healthcare ecosystem, their electronic health records must be available, discoverable, and understandable. And so also for machine-based processing, this data needs to be structured and it needs to be standardized. So FHIR is the acronym for Fast Healthcare Interoperability Resources Specification. It is a standard for exchanging healthcare information electronically. So FHIR aims to simplify the implementation without sacrificing information integrity. And it leverages existing logical and theoretical models to provide a consistent, easy to implement, and rigorous mechanism for exchanging data between healthcare applications. And FHIR solutions are built from a set of modular components called resources. And these resources can easily be assembled into working systems that solve real-world clinical and administrative problems at a fraction of the price of existing alternatives. And so FHIR is suitable for use in a wide variety of contexts with apps, cloud comms, EHR-based data sharing, server communication, and much more. So for my non-technical audience out there, this is the foundation that will enable you in a few years to have access to your EHR on your phone for free. And so let's talk more about why all of this matters. Why am I here talking about interoperability in the future? Well, COVID has emphasized the need for putting patient information in their own hands and for increased data sharing. And I will talk about that a little later. We need to enable patients to partner with other entities in their health journey, because this can open up opportunities for diagnosis, treatment, and management of many diseases. And the technology is ready. We're always talking about, even in this conference, digital transformation, technology changes. The technology is ready to support this undertaking. And so these modern computing standards and APIs can give patients access to their health information while protecting security and privacy. So what is the state of interoperability? What does this look like right now? So hospitals and health systems are taking action to address interoperability within their organizations, but they still face challenges sharing clinical data with other health systems, tapping into unstructured data, and using that data to reduce the cost of cares. So these are some findings from a recent survey by HIMSS Media and the Center for Connected Medicine. And it is a survey of healthcare, IT, business, and clinical leaders. And this is what they said. So 37% said that they successfully share information with other health systems. 51% said that they easily share data with pharmaceutical departments. 57 report success in sharing information with their patients, and 58% report success in sharing data with payers. So I will say we have come very far these past few years. There is no denying that. But as the numbers show, we have a long way to go. And so why is interoperability important? Well, I highlighted only 4 key benefits here, but we can spend a whole day talking about why increased data sharing supports a variety of beneficial use cases. So health information exchange can enable better patient access to their health information. It can reduce burden on payers and providers, and it enables patients and their healthcare providers to have the opportunity to be more informed. And this being more informed can lead to better care, improved patient outcomes, and again, reduced costs. So when data flows freely and securely between payers, providers, and patients, we can truly achieve that coordinated care. And I was thinking about why I chose this topic, or why I focus on a future market that does not yet exist. It's been a dark year, as we all know, and this provides such a positive outlook on what we can expect to leverage our health information from. So let's talk about what will be possible, what would be enabled. Greater patient safety. So by creating and implementing advanced interoperability with the aim of not only capturing and sharing, but also interpreting data across systems and applications, healthcare orgs can better prevent errors, which can lead to patients being safer. Better patient experiences. So this is tied to improved care coordination. And by using interoperability to streamline care coordination processes, healthcare facilities will be empowered to give patients a faster and more accurate coordinated treatment, enhancing their overall experience. Reduce costs. So interoperability gives the opportunity to save time with every patient encounter, because you get the right data to the right patient, provider, or affiliate at the right time, every time. So imagine the possibilities of that. There's definitely reduced costs and reduced burden. And this last one, more precise public health data. I know that this resonates with all of us who have been looking at COVID-19 dashboards and seeing how our state, for those of us in the US, is faring on that particular day, or our country. And so faster and more accurate collection and interpretation of public health data is possible when these IT systems are able to share data and interact. And so in a situation like the one we've just found ourselves and still find ourselves during this pandemic, this can help organizations answer pressing questions for both patients and providers. But of course, I can't sit here and talk to you about sharing health data without discussing privacy and security, right? So a security report on the health of mobile health apps, and this is a recent one, found that 71% of healthcare and medical apps have at least one serious vulnerability that could lead to a breach of medical data. And 91% of those apps were said to have mishandled or weak encryption. So what this means is that the encryption is actually can be broken by cyber criminals, and it can potentially expose confidential data and enable attackers to tamper with the app. And so as it comes to privacy and security, consumers are not sold just yet, because 38% rank concerns about their privacy or their data security as the #1 barrier to adoption of digital health tools, whether that's chatbots, computers, digital devices, for their health questions and for their care. 60% of consumers ranked that doubts on the effectiveness of these tools is among the top 4 barriers for adoption. So I thought this was quite interesting, because I saw a couple of surveys that tied privacy to the effectiveness of the tool. And I think here is where we see how driving value and being effective for the patient will be key to adoption. And adoption will then, of course, be instrumental to how we measure the true impact of these digital tools, these digital health interventions. Right now, we have some literature and some research on that, but it's not until things are fully adopted that we can actually tell whether they're working or not for patients. So do I have good news to you about privacy and security concerns? Well, a few. So the pandemic spurred an increase actually in what is called solidarity-based healthcare. And this is actually where the focus is more on public health in the aggregate and less on individual data, and it infringes less on a little bit of those privacy rights. Then also learned that survey respondents to feelings about embracing these digital health apps, that they felt more comfortable when they had control over and understanding of data that was highly valued. So I think, this is tied to that effectiveness portion. If patients, users, consumers feel comfortable using that data, then they and they understand it, then they're more likely to use that. And more good news is that just as I've explained about and how we've been talking about innovation and technology advances, the same is happening with application protection and security. And so these technologies can use new security developments to bring their organizations up to speed, to bring the security of their apps up to speed. So the presentation so far was meant to set up context for this analysis. So greater interoperability alone brings benefits and is a result of removing the obstacles of data free flows. But when combined with advances in AI, IoT, analytics, and other digital innovations, it will push forth technology solutions uniquely positioned to influence health outcomes and reduce burden. So let me tell you what I did here. So I conducted a lit review of publicly available Gartner Hive cycles. So the Gartner Hive cycle methodology provides a look into how technologies or applications will evolve over time and educates the reader on the promise of an emerging solution. So Hive cycles that were reviewed for this analysis were the Hive cycles for healthcare providers, digital care delivery, real-time health systems, and for payers. Then I examined and selected the technologies found in these Hive cycles that have a maturity or development framework dependent upon this patient access to EHRs and greater interoperability, regardless of their assigned time to maturity. And then lastly, I supplemented these findings with a look at the value of the digital health market, a view of the consumer sentiment, and use this insight to inform considerations for the future. So what did I find? I found 8 technology solutions that stand to gain momentum. Note that there are plenty of benefits to widespread interoperability, as discussed earlier, and we could take up an entire day talking about those benefits. But for the purpose of this analysis, we will focus on scenarios where patients have that easy access to their health data, thanks to those rules like I explained earlier. So first thing, automated patient decision aids. So these are software-based interactive systems that leverage AI to help patients make better health decisions and improve the alignment between the patient's decisions and their personal values. So these aids may include diagnostic options, treatment options, end-of-life choices, and they contribute to a shared decision-making process because they improve a patient's knowledge and their accuracy of risk perceptions. This is an automated tool that uses insight gained from patient history or from interactive questionnaires to establish an understanding of the values, needs, constraints of the patients. And so you will hear me say this as I go, but these are the kinds of tools that will be highlighted, the ones that need and use health information to bring value. Now let's talk about critical condition surveillance systems. So these systems monitor clinical data from the electronic health record, from medical devices, and from diverse data sources in real time. And they are able to become predictors of deterioration and even result in reduced mortality. So this software uses disparate clinical and non-clinical data sources combined with predictive analytics. And this is the type of system that will fare best in an environment with high interoperability. And the value here is pretty big since it is directly related to reduced mortality because we're talking about critical conditions. Medical shopping and transparency tools. So we talked about how interoperability will contribute to reduce costs. These solutions replicate the kinds of experiences that we have grown accustomed to in other industries. So they can serve as a medical concierge that searches for and schedules visits. It allows consumers to shop for care based on quality, ratings, cost, and location. I think the best example that I can give you for this right now is ZocDoc. And so transparency tools allow patients to consider two or more alternatives for receiving certain medical services, and they provide price comparisons. So this is actually an area that has been hindered by a lack of interoperability. So with greater integration, they will be given the opportunity to bloom. And that increased data sharing will allow stakeholders in healthcare to have access to copay, plan costs, deductibles, and alternative cost-effective recommendations for medications and procedures. Personal health management tools. So this is where all those apps live. This is the umbrella term. And these are the technologies that aid consumers in managing their health and wellness. They provide interactive functionality beyond simple educational content, and they can include capabilities for tracking symptoms, diet, exercise, and routine care. They also help with monitoring chronic illness, and they connect to wearables or sensors. So these we can expect to develop greater personalization and impact as they actively not only use, but contribute to a clinical health record data. Shifting to the next one, virtual health assistants. So these are specific to the complexities of health and medical care, and they can integrate with the consumer assistants that we all know, and some of us may even have in our homes. But these guide patients through their daily activities. They help patients remain compliant with health and medical needs, and they often initiate that interaction to remind the patient to perform a certain activity, whether that's taking a glucose or blood pressure reading, weighing in, taking a medication. And so these are essentially conversational AI platforms that integrate with these different hardware assistants. And so as they mature and gain access to electronic health information, they will be able to do things like pick up on mood using sentiment analysis, and they can contribute and use that patient health information. And that this is going to drive a lot of value, not only to patients, but to the care team. Community resource network management. So community resource network management is actually an operational model. And in this instance, an entity, a payer, a provider, a government agency adopts the utilization of community resources by the individuals it serves. So with greater interoperability, healthcare stakeholders will be able to understand and even impact social determinants of health. Widespread interoperability will enable them to extend their reach beyond the healthcare systems and into the communities of their patients and members. So one use case is to better coordinate efforts, treatments, and sometimes to even coordinate payment with community resources. I find this one to be pretty interesting because there are resources in key communities that have the will and the ways to help, but are just limited in their understanding of a patient's history. Conversely, providers and payers are limited to, what happens within the healthcare system. So having the patient be able to share that information with the community, not just organizations, I'm talking about broader communities like family members, neighbors, schools, be part of and contribute to the care journey, I think that has potential to have tremendous positive impact. Healthcare consumer persuasion analytics. So healthcare consumer persuasion analytics utilizes consumer, clinical, experiential, engagement, social, environmental, and behavioral data to derive and understand the needs and preferences, key motivators, and influencers of individual health behaviors and outcomes. So this combines insight with advanced analytics to identify techniques and tactics that can persuade consumers to undertake actions that benefit their individual health. So this is actually a behavioral psychology spin on things. And a primary driver for this consumer persuasion analytics tech is that it is a breakthrough in one of the biggest hurdles in improving health outcomes, and that is changing the behavior of individuals who may be uninformed, unmotivated, or even biased against changing those behaviors. So again, anything that leverages data to create value will be positively impacted by greater interoperability. And lastly, care team collaboration ecosystem. So care team collaboration involves healthcare providers that work together toward a shared vision of disease management, treatment, or recovery. So greater data sharing will enable not only better workflows, but it will ensure that the teams across the care journey are informed and updated on patient history. And this actually has been traditionally a source of friction between care teams. So the care team of the future will not only be supported by widespread interoperability, but they will have IoT devices, AI, and other real-time health solutions to provide context on the patient and operational intelligence. So these are the technologies that will gain momentum. But what is the market opportunity here? So this is actually a graph I pulled from a McKinsey study, and I like this because it classifies the different startups into value pools. And I've been mentioning throughout this the importance of value. And I like that instead of labeling the name of what the company does or offers, it actually categorizes them into these value pools across 5 main categories. So let's look at this. This is the market as of 2019, representing approximately $350 billion US dollars. And there's so much opportunity in this market still across multiple subcategories. So there is an appetite for growth out there in this field. And I want to showcase with this that the field is wide. There is a lot of potential that will only grow as interoperability becomes more widespread. And this is not just a flat opportunity for financial gains. There's also a great savings and cost avoidance potential. So in this same estimate, based on 2018 healthcare spend information, McKinsey estimates that digital health interventions alone are going to have the potential to save the US healthcare system nearly $500 billion if fully adopted. So beyond that, there's growing evidence that digital health intervention can improve health outcomes across a range of areas. So we went through this value, opportunity, technologies, but for all these technologies and valuations to come to fruition, consumers need to adopt the tools, and they need to embrace the fact that they will eventually have access to these EHRs on their phone. And so, as I just noted, the cost savings potential, the cost avoidance potential of these technologies is dependent on full adoption. So let's take a look at where we are on adoption. Consumers' use of digital tools to manage their health had declined before the pandemic. So that's a not so fun fact. And actually, according to a digital health survey by Accenture, 33% of US consumers were not using any digital tools to manage their health. A separate survey by Deloitte found that consumers were more willing to share their personal health information post-COVID. And here we see that 71% of consumers were more willing to share with their health insurance as a result of COVID compared to 65% pre-COVID. Similarly, 73% sharing with their local health system I'm not going to say post-COVID because we're not there yet, but as a result of COVID compared to 71% pre-COVID, and 18% willing to share with tech companies compared to that 15% pre-COVID. So what do these numbers show? They show that we have ways to go. So now I am going to wrap it up because I know that I'm almost at time, but this analysis drove the key considerations that I am about to discuss and things that are central to driving this adoption. So there are 3 on this slide, but there's one that is underlying, and you probably already guessed it, and it's value. So a lot of the value, the effectiveness, a lot of these privacy concerns that I explained are tied to this. And new entrants will have to ensure that the solution that they're thinking of bringing to market is actually that brings value. And I think for in this case, no frills demonstrations of the benefits of certain solutions and applications will go a long way. Of course, we have addressing these privacy and security concerns. So as health data is shared broadly among providers, health plans, and third parties, those privacy concerns, they will rise. And so for new entrants to thrive in this highly interoperable environment, they will need to have security and privacy mechanisms in place from the onset. And they will have to design with these in mind to earn consumer trust. Patient education. So just as there will be a new market for patient access, there has to be a parallel market for patient education initiatives. Privacy and security concerns are going to drive patients to seek clear and concise details on the implications of sharing their electronic health information. And education and awareness are going to be an essential factor in driving this adoption. Now we have literacy disparities and barriers to information access. So recent studies show that literacy-related disparities in technology access and use are widespread, and that patients with lower literacy rates are also less able to access and use the internet, particularly for health reasons. So as we dive headfirst into a new market, I want to make sure that these applications and technologies, we need to avoid exacerbating existing discriminatory patterns. And this to me is a very strong consideration because innovation we cannot risk furthering these health disparities. And so this should be a priority for new entrants and folks who are already in the market. So with that, I thank you for your time and attention, and I turn it back to Atul.
Great, thank you. Very interesting talk. Question just popped up on the screen.
Does FHIR protect the healthcare data? If so, can you explain a little more about how and why FHIR can improve the security for exchanging EHR? If not for a healthcare digital application, what will it take? What will take the responsibility to protect the patient's data? That's a great question. So let's go back to the definition of how I'm getting more questions. I'm reading them and finding the answer.
Ignore the next question for now. Yeah, just focus on this one.
Yes. So FHIR is a standard that APIs will have to meet for these rules. And they support privacy and security of patient information because the standard provides these resources that I explained. So the aim is really to have a standard for exchanging and having that ability to share that healthcare information electronically. And I think, when this undertaking happens, we're about to see exactly how different entities will go about adopting, and we are actually going to see, security and privacy sort of not concerns, but considerations come to flow. So then I'll go to the second one.
Let me just add a little bit to that. So there are point solutions today that allow data exchange between system A and system B today, different EHRs, right? They are using FHIR to some extent. FHIR has been around for a while, but the new ruling has opened up the possibility for patients to get access to the data in addition to a hospital talking to another hospital, right?
Yeah, so this is, like I explained, health system to health system, payers and patients. And then when the patients have access to that data, we can do what we would like with that data. So if we want to share with a third-party app, that's there. So when I talk about the privacy and security concerns, that's coming more from the ability to share with a third-party app that is no longer covered by HIPAA.
Right. Got it.
Yes.
Okay, let's take the next question.
So I mentioned medical shopping. What is the state of the art in terms of estimating costs, e.g. the cost of a hip replacement surgery? So for each one of the technologies that I mentioned, there is a long write-up and I reviewed all of them. Whether I can answer what is the state of the art so far, I mean, I think the answer is in the presentation. The state of the art is about to come because this field in particular was limited by sort of a lack of that information on pricing and costs and copay. So I think we're about to see the state of the art, honestly, in the next few years when all this information can be leveraged by these medical shopping solutions.
So you referenced transparency of cost in one of your slides, right? I think
Yes.
Ravi is referring to the same slide.
Mm-hmm.
The ruling on cost transparency, is that part of the same ruling that allows patients to access their own data, or is it a separate ruling?
Right. So I focused on the technical portion, the API portion, the standardized criteria for API. So the sort of expectation is that the ability to share information is going to be widespread, and that is going to include then information about costs and prices.
Okay, good. Any other questions, folks? Otherwise, I have some. So nothing coming up yet. So how far are we from a universal health data repository that every hospital and every consumer can subscribe to, but one golden source of data where all the data is stored? I don't think this ruling is enabling that. This ruling is simply allowing patients to access their data and authorized third parties to access their data.
So you say universal, and
yeah.
I do want to be clear that this rule is US for US entities, right?
Yeah, even within US, this ruling is not allowing a creation of a universal health repository, right?
No, that is not part of that.
Yeah.
But I think that what we're playing right now is a wait and see, a game of wait and see, because I mean, I just touched on a small part of what is going to be unlocked, right? I focused on patients too. But if we were to talk about providers and payers, then that opens up, you can do something similar to this on those stakeholders.
Yeah.
So it is possible. And again, it's a game of wait and see of how will this new ability to have your information on your smartphone, and for not only for patients, but for folks within the stakeholders ecosystem, the healthcare ecosystem, to have that information, what will it be put to use? How will it be put to use?
Good. You talked about consumer persuasion analytics, and the name that comes to mind when I hear that term is Noom, right? But because this ruling is not implemented yet, they don't have access to people's health records, right? They're simply working off what knowledge they have that you enter into their system, tell them about your conditions and what better health outcomes you want through what kind of habits. And they help you, they persuade you on a frequent basis, right?
Yes, and I mean, they already have access. So Noom is a mobile app, right?
Yeah.
And like like other apps, it's on your phone, and so it has access to everything that I have consented for it to have access to.
Okay.
So I do want to emphasize that as we go, these technologies that they drive value from having all this data will have even more impact, because there will be more data that they can connect. So now that app is not only going to know stuff that I do on my phone, it's also going to know everything about me medically.
Yeah.
If I allow it, right?
Yeah.
So I have a question. Wasn't a global EHR one of the promises, objectives of the ACA? So I'm going to refrain from commenting on ACA, but I am going to say that the world is sort of, we're taking a big step here in having, this is a huge undertaking. It's something that is going to have a lot of impact on us as patients, and it can contribute. Again, this is one that I'm going to say it's a game of wait and see. Who knows what will come from all this data access.
Mm-hmm. You talked about the COVID-19 context and access to better population data for better tracking of the virus and spread of the virus, right? How about the other aspect to this COVID-19 relevant is if I go into an ICU of some hospital that I've never visited before, they don't have access to my medical history. They don't know whether I have any conditions that make me more likely to need a ventilator, right? So
they may or may not,
yeah.
Right? And so what we are striving for is a future where they likely will. Yeah. It's not you're not walking in blind. You will likely, and if not, you carry it yourself. Yeah.
There are countries where you carry your history on a USB stick or something similar, right? Yeah. Again, a very, very interesting talk, and we are all looking forward to new innovations in this space now that the ruling is out there. And I think it's set to go into effect early next year, right? Or at least it was when it was released, right?
Mid, but because of the pandemic, things
might be pushed
sort of
out
keep changing.
Yeah. Okay, good.
Yep.
Good. Again, thank you very much. Thank you, Cynthia.
Thank you.
Sure.
Bye.